Our next speaker is Dr. Jimmy Lim. Dr. Jimmy Lim is a consultant cardiologist. He is with the Novena Heart Center. He has trained in the US and in Singapore in quite a wide aspects of cardiology, including prevention, interventional work, as well as rehabilitation. He was with Tan Tock Seng from 2004 to 2007 before he went into private practice. And today, his topic is, how do I know if I have heart disease? Dr. Jimmy Lim.
It's okay. Okay, let's see if this PowerPoint works. Huh? Yeah, this will blame Bill Gates and Microsoft again. Okay, anyway, my name is Dr. Jimmy Lim, and unlike the other two speakers, I'm actually a heart specialist, so please afterwards don't ask me anything about kidney. I know nothing about it. But today I'm going to address perhaps a question that actually seems very simple, but perhaps even today in modern cardiology or heart medicine, there's still a lot of debate going on, and I'm going to bring you through some of the issues why we don't really have a conclusive answer about who we should screen and how we should screen. But we do know, and we all agree upon the fact that heart attacks are very devastating things to happen. We estimate that the people who get heart attacks, it usually happens suddenly, very often either without warning or people don't recognize the symptoms. And in fact, 1 in 3 people will die before they reach hospital when they experience their first heart attack. So as a doctor at the other end in the hospital, very often we see people coming in. And I used to work at Tan Tock Seng Hospital, and we have the most number of heart attacks because, you know, they say the feng shui at Tan Tock Seng is very good. It's at the junction of all the AYE, CTE, PIE, everything's there. So what happens is that when you have somebody with chest pain and the ambulance officers know that this is a very dangerous thing to happen, it's a hot potato, the person can die on you en route, they want to bring you to the fastest route possible, so everybody ends up in Tan Tock Seng's doorsteps. So the A&E always got a lot of heart attacks. And the thing is, although we see a lot of people coming in, and some people will die after reaching hospital, unfortunately, a large majority will even not reach the hospital. They will actually are found dead, and they don't even make it to the A&E. So therefore, there's no doubt that it's a very devastating disease to have. The survival rate for somebody, including those who have not reached hospital and those who reached hospital but didn't survive, in fact, the survival rate is 60% at 1 month, which means 40% of people who get a first heart attack actually don't survive. So that's no doubt that screening is very important. You don't want to wait until you get it and then start medicines. What are the symptoms? Well, you know, we always say classically, this is the guy, you know, in the picture that, you know, he's feeling breathless, he's holding on to his chest, he's unwell, you know, he may feel giddy, and then when you walk, the symptoms get worse. Now, these are the typical symptoms that we would describe a person who may have what they call, the technical term we use is angina if you're from the UK, or angina if you're from America. But basically, it's just a fancy medical term to say that you don't have enough oxygen getting to your heart because there are blockages of the heart arteries, and these are the symptoms that people tend to present with. It sounds simple enough, but the problem is that most of the time in the A&E, we see young people who don't have a heart attack with sharp pain, who think they're having a heart attack, and then the older people and sometimes diabetics and women, they don't realize that the symptoms may be just pressure over the chest, and they think it's indigestion, and so they stay at home. So the people really in trouble are staying at home, and the people with nothing wrong with them are going to the A&E. So that's the problem. And so we come up with this concept of being the iceberg. Iceberg, you know, you look at the iceberg, it looks really small, so how can it sink the great Titanic ship, right? That's because the majority of the iceberg is actually hidden under the water. So the people who present with typical symptoms, which you see on the surface, you can recognize it, actually only comprise maybe 20% of people who have significant disease. 80% of people who don't have typical symptoms or don't even recognize the symptoms or have no symptoms may also have bad disease. And the question is, how do we pick these people up? Now, I can give you some real-life examples. The person on the screen is infamous or famous for several reasons. It's Bill Clinton. And perhaps you may not realize this, but as the President of the United States, it is necessary for these people to go for screening every year. They don't want the President of the United States to drop dead from a heart attack, for example. So there's this hospital near where they work. It's called the Walter Reed Medical Center. Every year, the President has to go for a screening. So during his last term, he basically went for his usual screening test. They call it a nuclear stress test. They inject some dye. They make you run on a treadmill. Given clean bill of health. And actually, his cardiologist said, well, your cholesterol is high. I think, even though your treadmill is normal, you should continue your medicines. But Bill Clinton said, no, I'm not interested. If I'm okay, I want to stop the medication. So he stopped his medications. 1 year later, after he had stepped down from being president, he had a heart attack, found he had 4-vessel disease and underwent bypass. And so how is it that so-called the President of the United States gets missed? How is it the treadmill is normal? And I can tell you that, and I'll explain this in a short while, how this is possible. Another person that is not familiar to us, but we're very familiar to the Americans, more contemporary, is this poor chap called Tim Russert. He's famous because he's a political correspondent. Every time people talk about, the presidential race and elections coming, he is the guy that everyone watches on TV. And he actually died Sunday night, last year, while filming in the studio. And then even though they had medical personnel at the studio, they couldn't save him. The ambulance arrived, he was dead. Now, the interesting thing why I bring up Tim Russert was that 6 weeks prior, he actually went for a treadmill test, and it was told that the treadmill was normal. So what's happening here? How come people are dying even though the treadmill is normal? Well, it's all to do really with this whole idea of what actually causes heart attacks and what happens when you have a heart attack. So if I can show you, if we're looking at my red dot, this is what is the problem. There's cholesterol deposits on the internal surface or the inside of the artery that eventually can bung up the whole artery and give you a heart attack. But this takes many years to form. So, in fact, from this stage, which you hardly can see any cholesterol, to this stage, it takes many years. So if it takes many years to form, why are heart attacks sudden? Well, heart attacks are sudden because what happens is you don't actually see the cholesterol, because if you look at the internal aspect of the artery, this is the wall of the artery, this is where the blood flows. When you start forming cholesterol deposits, it actually forms on the outside, and your artery actually compensates by expanding outwards. So you can have a lot of cholesterol deposits in your artery before it actually begins to narrow down the artery. Even when you have so much cholesterol surrounding the artery, these arteries still look normal. And only when you have very bad narrowing, so much cholesterol that the artery can't grow fat anymore to compensate for it, then it begins to narrow down the artery. And in fact, what's very interesting is that, my patients always obsess about, when I do a test for them, they want to know how much percentage is my blockage. But the truth is, what's more important than the degree of narrowing, we use the word stenosis. How bad is the narrowing? Is it 80%, 90% narrow? More important than that often is how stable the narrowing is. What this chart shows you, and it looks a bit confusing, but it's very easy to read, is that this is an autopsy study. People who have died from heart attack, they do a post-mortem. If you watch CSI, you know what that means, right? So they check and see what is the artery that killed the person. And surprise, surprise, two-thirds of people who have died from a heart attack, in fact, the artery was narrowed less than 50%. And when the artery is narrowed less than 50%, you can do a treadmill, and the treadmill will be normal. It's only when the narrowing is more than 70%, then the treadmill shows it up, because 50% narrowings are not bad enough for you to pick it up. The oxygen supply to your heart is very good even when you're running. So the majority of people who get heart attacks is due to narrowings that cannot be picked up by treadmill. So what's more important is the stability. If you have a very stable 80% blockage, you might get chest pain every day, but you may not die from it. If you have a 30% blockage that's unstable, the thing ruptures like a pimple, bursts, the cholesterol comes out, a clot forms, and you have a choked artery within minutes, and that's what causes the sudden death in all those marathon runners that you see. I mean, if they have bad blockage, they can't run marathon in the first place, but they don't. They have minor blockages, but the rupture, the unstableness of it causes the heart attack. The analogy I tell my patients is like, you live next to the biggest volcano in the world, but the volcano hasn't erupted in 800 years, you're probably safe. If you live next to a tiny little volcano, but every year it erupts, you're probably going to be in trouble anyway, right? So this is what it looks like. Notice that the black stuff is a blood clot. Notice how these arteries don't actually have narrowing in them. They actually have cholesterol on the outside, but what happens is the cholesterol leaks out and a clot forms. So you can imagine before this happened, the whole artery looked pretty big, but because the blood clot forms and chokes up the whole artery, that's why the event is sudden. So even a little bit of cholesterol deposit can get worse, but it can also give you a heart attack. And that's where the problem comes with screening, and that's a big debate. Now I'm going to go into the actual part so you kind of understand what's going on, what causes heart attacks, and so on. So the traditional approach is what we call risk profiling. We will ask you a lot of questions, we will check your blood pressure, take your cholesterol, and then based on this, there's even equations that you can enter. There's online equations that you put in, fill in the blanks. It tells you what is your risk in the next 10 years of getting a heart attack. It's all great. because, and it's also well proven. So it is a very useful way of doing it. But the problem with risk profiling, and I'll give an example, is that just like the police, in a bank robbery, for example, if someone robbed a bank and the police put out a roadblock, what will you be looking out for? You'll probably be looking out for a whole group of men. In America, it's more likely to be a black man rather than a white man, not that they're racist, but unfortunately the black people are more likely to commit serious crimes, as they'll tell you. So they are actually profiling people to stop at a checkpoint. Now, you would think that as far as risk profiling goes, if you had a bank robbery, you would more likely stop this guy than stop these two ladies, right? But this guy actually is a very rich rapper, and he actually has never robbed a bank. He says he does drugs, but he doesn't rob banks. But these two ladies actually taken off a security camera. These two single white females actually robbed the bank. This is just before they actually robbed the bank. So you stop the wrong guy because you risk profile him, and then you let the two ladies go, right? So the problem with risk profiling is most of the time you're going to be right, but there are exceptions to the rule. And to give you an example is Arthur Ashe, first Afro-American person to win the Wimbledon, very fit, gets a heart attack at age 36 and has bypass. Winston Churchill wasn't always this fat, handsome young cavalry officer before, but let himself go. But look, eventually, even under stress and smoking cigars all his life, he died at age 91 from old age, never had a history of stroke or heart attack before. So risk profiling would have not helped these people. You would have never expected Arthur Ashe to have a heart attack at age 36. So some people are now saying that risk profiling is great. You should still do it. You should still know what your cholesterol is doing. You should still know what your blood pressure is doing. It doesn't replace anything. But we should use something else on top of that. And that is using some of the latest technology that we have that can actually see the arteries. In other words, great, you have high blood pressure, you have high cholesterol, you smoke. You're more likely to get heart disease. But do you really have heart disease? Do you really have blockage of your heart arteries or your neck arteries for that matter? Nobody really knows. We're guessing, right? So why not take the guessing out of the game and just image it? So what do we have in terms of imaging? Well, let me tell you the concept first. I like to tell stories, as you can tell. Those of you who remember the Falklands War, the British lost a ship called the HMS Sheffield. And the problem with the HMS Sheffield is that they have very lousy radar. And so what happened was they only had 5 seconds between confirming that a missile was headed towards them and to react. What can you do in 5 seconds, right? You can't do anything in 5 seconds, okay? But nowadays, we have this thing called AWACS, which are early detection systems. If you had an AWAC, or eye in the sky, as they call it, they could have seen the Argentinian planes taking off from the runway, and you have had 30 minutes lead time to prepare yourself. In other words, early detection allows early prevention. So if you had this system where you can detect things very early on, you have much more time to do something about it than say, hey, you're going to get a heart attack tomorrow, what are you going to do about it? It's too late, right? So is this something that's novel? In fact, as a cardiologist, I personally am always very mystified because some of other colleagues who are cancer specialists find it very routine to screen, use some special tool to screen for cancer. But, you know, like women, it'd be breast cancer through x-rays, cervical cancer through smears. Men, you can do the prostate through blood tests and so on. And even colon cancer you can detect. But cardiologists have not really thought about what we should do for screening. Screening is a very novel idea for cardiologists. Well, let me tell you the two things that now are recognized as useful screening tools. As you know, this is Time magazine, very important magazine, so, you know, whatever appears in it must be pretty important. How to stop a heart attack? Well, what they're talking about is CT scanning. CT scanning, basically, there's two types of scanning. One, you inject dye so you can see the artery. The other one, you scan without the dye. But the scanning without the dye is the one that's recommended for screening. That's people who are well but want to know whether you have early disease. Because what CT scanning can do is it can pick up deposits of calcium. Now, why calcium? Calcium goes to your bone and teeth. It doesn't go to your heart arteries or any artery for that matter. But if you have cholesterol deposits in the artery of the heart and damages the lining, the reaction of the body is to form calcium. X-ray cannot see fat, so you cannot see cholesterol, but you can see calcium. So we use calcium as a way of telling us whether you have deposit of cholesterol. So if you have calcium of 0, you're doing very well. If you have calcium of 1,000, you're in trouble. You need to go and see your doctor very quickly. Okay? And scores can even reach 2,000 sometimes. And in fact, the evidence shows, and this looks very confusing, but very simply it says that no matter what age you are, whether you're young or you're old, if your calcium is more than 400, you are much higher risk than somebody with a low calcium score. In fact, if your calcium at under age of 40 is more than 400, you have a 13 times higher risk of dying from a heart attack or stroke in the next 7 years. This is not 17 years, but 7 years. So definitely it's useful, and it's an easy test to do. You don't even take off your clothes. You just lie down there, 2 minutes is done. Okay? The other thing that we like to do is this thing called ultrasound of the neck artery. Now you say, what is the cardiologist doing with the neck artery? Well, the point being that the arteries of the heart are too small to be seen by ultrasound, so we use the calcium scan. But you might not want to subject yourself to